The Region 1 Medical Center bears witness that no adversity could hinder progress as it advances to the next level of the performance governance pathway. Indeed, a giant stride for a government institution to undergo the first 3 stages of the PGS journey for 3 consecutive years. The R1MC embarked on its PGS journey in 2019 and bagged the Gold Trailblazer Award during its initiation stage. In 2020, the R1MC was conferred compliant, this time bringing home the Silver Trailblazer Award. And there is no stopping for R1MC as it now progressed to the proficiency stage, highlighting its breakthroughs amidst the challenges of the COVID-19 pandemic. Starting off with 2 subspecialty centers in 2019, the R1MC takes pride as it now brings the 13 subspecialty centers for the people of Northern Luzon. With our aspiration to move forward in leaps and bounds, we ensure everyone that we shall remain true to our commitment to achieve service excellence in healthcare through the full support of the performance governance system. As we prepare for the institutionalization stage, allow us to share with you the highlights of our proficiency journey. This strategy map, aligned with the universal healthcare and the F1 Plus, has gained headway since we were initiated in 2019. We started implementing this plan in 2020 despite the challenges brought about by the pandemic and was conferred compliant last year, and now we are ready to report on even greater accomplishments for 2021. When we started this journey in 2019, we had the capability to provide specialty care in only 2 fields of subspecialty, namely the Eye Center and the Kidney and Transplant Center. 3 years after, we are now capable to provide 13 subspecialty care with either basic or advanced service capability. 6 of these are mandated by the Department of Health, while the other 7 centers are the R1MC's initiative as its contribution to the implementation of universal health care. Currently, we have 13 centers, and we would like to highlight 5 of these and their emerging breakthroughs relative to our strategic position of becoming the preferred multi-subspecialty center in Northern Luzon by 2024. The R1MC Eye Center is already existent when we were initiated in 2019, but based on the resource stratified framework, we only have 85.9% level of service capability. Currently, we are now 88.1% basic comprehensive capable. In addition to the services offered in 2019, the center now has the following. 3 years back, patients with complicated eye problems were referred to big eye centers in Manila. Today, our eye center is now capable of managing external disease in cornea, vitreoretina, orbit plastic lacrimal, pediatric ophthalmology, glaucoma, ocular inflammation uveitis. With these new services, we have already performed the first corneal transplant and the first phacoemulsification in a pediatric patient with congenital cataract. Previously occupying a small office at the old OPD building, the center now occupies an entire floor of our new OPD building furnished with state-of-the-art opto equipment. In terms of metrics, the census has gone up tremendously from the time it started in 2018 up to the 3rd quarter of 2021, as you can see in this slide. Next is our Dermatology Center. A few years back, the dermatology service is not yet even a department. It was manned by only 1 dermatologist and supporting staff, and services were purely consultation on diseases of the skin, hair, and nails, with a few minor basic procedures for 15 years. It was recognized as a department in 2018 with a service capability of 87.9%, which eventually increased to 90.2% as an advanced comprehensive center. In terms of services, the department now offers a wide array of services in response to the changing needs of its patients. In terms of subspecialties, the center now offers the following services: dermatopathology, pediatric dermatology, dermatologic surgery, laser and cosmetic dermatology. Another breakthrough of the center was its achievement of full accreditation as a training institution on July 8, 2021. To date, the R1MC Dermatology Department is the 13th PDS accredited training institution and the only recognized training program in Northern Luzon. Previously, occupying a 12 square meter room at the old outpatient department building, the center is now located in a spacious clinic furnished with state-of-the-art equipment such as with the bigger space to accommodate more patients, more subspecialty services and equipment available, the number of cases catered by the department markedly increased in its second year as a department in 2019, which coincides with the adaptation of PGS at R1MC. The next center that we would like to showcase is the R1MC Cancer Center. Actually, this center was not yet existent before we started our journey. It was initially launched as a cancer prevention program in 2001. And just like dermatology, the cancer clinic also occupied a small space at the OPD building, manned by only one oncologist and a nurse with only one chemotherapy chair. At the start, its service capability was barely 58.6%, and now has a comprehensive subspecialty services capability equivalent to 75.2%. Starting out with only one adult oncologist, the center is now managed by specialists in adult and pediatric oncology, gynecologic oncology, trophoblastic disease, surgical oncology, and radiation oncology. The completion of the Cancer Center infrastructure is currently on progress and almost ready to become fully operational by this year. We are expecting radiation therapy as part of our service, which includes 3D conformal intensity modulated radiation therapy and brachytherapy, which are being used for certain malignancies. In this slide, the number of cases is continuously increasing since its establishment in 2019, a proof that the center is now being recognized by cancer patients in the region. The Center for Emerging and Re-emerging Diseases was not originally included in the list of R1MC initiatives in 2019. However, as a response to mitigate the unprecedented consequence of the COVID-19 pandemic, the leadership team of R1MC prioritized its establishment after a strategy refresh in March 2020. Indeed, another breakthrough that the infrastructure was completed in just more than a year. This 41-bed capacity building catered to COVID-19 cases since it was opened in August 2021. It is equipped with operating room complex, labor and delivery room, and intensive care unit. It also has negative pressure ventilations, central supply section, 16 suite rooms, elevator, pharmacy, and nurses station with central monitoring system. The center is manned by 2 adult and 1 pediatric infectious disease specialists and 36 infectious disease nurses. As a subspecialty center, it has already admitted to about 436 patients from different towns of Pangasinan and other provinces who were accommodated in converted COVID wards, tents, and the newly opened CERD facility. The Center for Mental Health started as an acute psychiatric unit in 1998, which occupied a small room at our outpatient department and catered to around 15 cases per day. It was officially established by DOH as a Center for Mental Health in February 2021 and occupies a partially completed infrastructure located at R1MC Annex. Initially, the APU service capability is rated at 73.9% and has increased to 80% as a center for mental health. It is expected to be fully operational as a basic comprehensive center by 2023. The department is composed of 4 psychiatrists, 2 residents, 1 psychologist, nurses, and support staff. The department then started its outpatient services only at the moment, pending completion of the inpatient wards. Since it started, the center was able to cater an average of 491 patients per day. And the census continuously increased as majority of the patients of Baguio General Hospital Psychiatry Department cannot travel due to restrictions that were implemented during the pandemic. Another breakthrough is on research. With increased awareness and involvement of hospital employees about R1Mc's strategic goals, they started to have quality research outputs with high impact to the community. Before the PGS, majority of the output are clinical researches and usually done by resident trainee only as compliance for graduation. Only a handful are management topics, but as you can see in this slide, since we started our PGS in 2019, management researches are almost always at par with the number of clinical researches done. Through the hospital's research service, 6 clinical pathways for the different subspecialty centers were already accomplished. Evidence that researches now are not merely for compliance was the inclusion of the coronavirus disease testing research proposal by a first-year pathology resident during the annual call for submissions by the Health Facility Development Bureau for funding grant by the Department of Health. Another pride of the R1MC was a research done by a second-year internal medicine resident which won the first place in the 27th Philippine Medical Association Annual Residents Research Presentation, which also bagged the second place in the Philippine College of Physicians 51st Annual Virtual Congress Research Contest. And for our latest breakthrough, our ISO 45001 2018 certification. To date, the R1MC is the only government hospital in Northern Luzon and probably one of the few in the entire Philippines which is certified under these standards. Since we started the adaptation of these standards during the first quarter of 2021, we were able to achieve a customer-responsive and safe environment through enhanced protocols, and there were 0 sentinel events reported. Despite the myriad of adversities brought about by COVID-19, it has also opened the way to meaningful incremental changes. Improving our public health response through testing, the R1MC was able to establish the COVID-19 molecular laboratory, becoming accredited for RT-PCR, the cartridge-based testing, in February 1, 2021. The necessity of isolation and the high risk of transmissibility of the infection through face-to-face contact has also driven the R1MC to venture into remote healthcare provision. The R1MC IPA checkup provided patients the same quality of care within the comfort and safety of their homes. Doing our share in ending this pandemic, the R1MC is in full support of the Department of Health's Res Bakuna and Bayanihan Bakunahan as it conducted almost daily vaccination activities since the start of vaccine rollout in the Philippines. The attainment of these accomplishments will not be possible if not with strategy execution mechanisms that we put in place. Among R1MC's accomplished commitments include the formalization of its Office for Strategy Management. Maturity of the OSM at this point is probably one big factor in the successful implementation of R1MC's strategy up to this stage of the PGS. As their innovation are divided into different subcommittees with their specific PGS functions. The OSM together with the PGS core team, became R1MC's facilitating units. They work together to ensure the proper implementation of R1MC strategy. The PGS core team also created subcommittees based on the different KRAs to facilitate coaching and mentoring, which was found to be effective. Strategy reviews were consistently done on a quarterly basis, while operations review on a monthly basis. As also reported during the compliance revalida, the OSM developed tools and reporting mechanisms to measure the progress of the hospital strategy and unit-based deliverables. This monitoring tool became very effective in the updating of the scorecard. Last year, we presented this breakthrough monitoring tool for the different subspecialty centers. Since the start of its implementation, monitoring of their deliverables was facilitated. The OSM Subcommittee on MSGC Coordination were also consistent in their tasks as they scheduled MSGC meetings and provided updates to the MSGC members regarding the progress of the R1MC roadmap. The OSM also improved in communicating the strategy. Aside from conducting traditional orientations to cascade the information, the OSM together with PGS core team also came up with creative approaches to pique the interest of the R1MC personnel. Big tarpaulin of the strategy map were placed at strategic locations. Offices have a designated PGS corner, and PGS activities are also posted at the R1MC official Facebook page. Since our last compliance revalida, the PGS has slowly been integrated into existing systems at the R1MC, securing performance commitments of second-level units by way of cascading sessions and integrating the PGS deliverables to the Strategic Performance Management System was done in order to link budgets to the strategies. In addition, there is also a portion in the grading system of the personnel's performance-based bonus that is attributed to the strategic contribution of units or personnel to R1MC strategy. The OSM, through the Program on Awards and Incentives for Service Excellence, was able to give cash incentives to the top-performing units of the hospital. We will now highlight how we are sustaining the gains of our strategy implementation. As we progress through this journey, we have realized that we can't do it single-handedly and that we need the support of the persuasive and committed peripheral workforce through the MSGC. Since the MSGC members took their oaths in 2019, they have continuously helped the hospital in the realization of its services and programs. We reported during the compliance revalida that the R1MC and Pangasinan State University signed a memorandum of agreement through MSGC Vice Chair from the academe to assist the R1MC in the conduct of management studies. Since that MOA signing, several activities have already been conducted, and since then, several management research outputs have been accomplished. MSGC representative for Media Affairs, who was also responsible for conducting the Talakayan Media Forum, continues to cascade our services to the community through his radio programs and other special media forum, especially during the time of pandemic. Medical outreach programs were also conducted with the assistance of philanthropist MSGC member. This effort aims to bring to the community our subspecialty services. MSGC also helped the R1MC in the cascading of our online appointment system and the IPA checkup during the pandemic. The threat of COVID-19 did not restrict the MSGC to perform their role as our partners in our pandemic response. Through the MSGC, we were able to communicate the needs of our frontliners. Donations of PPEs, food and medicines flooded the R1MC. Even vehicles for the transport of our frontliners during the ECQ were also provided by different transport agencies. Internally, best practice sharing from the top-performing units departments is being done during monthly cluster meetings. These departments also share their best practices through the official FB page of the R1MC or during General Assembly such as flag ceremony. Externally, we use platforms such as attendance to media coverage, publishing of our own journal entitled The Podium, and posting in the social media. Moving forward, we have the following plans. Completion of the 7-story building. Translation of research output into hospital policies. Institutional Review Board accreditation. Center for Disease Prevention and Control. Fellowship training for the different subspecialty centers. As we prepare the R1MC to be the region's apex hospital on the implementation of universal healthcare law, we pursue with the completion of the 7-story building to house the different centers we are intended to put up. Many plans are at stake to make R1MC the preferred hospital of the people of Northern Luzon. Furthermore, in pursuit for the continuous development of government service towards the people's general welfare, the Center for Disease Prevention and Control will soon rise at the Bunuan Binloc Annex of the R1MC. The said project already had its groundbreaking last October 27, 2021. The challenge of translating research into policy is very evident and is affected by so many factors. It is then our goal to explore the process of research knowledge translation into policy with the number of management research outputs that we have now. Forthcoming accreditation of the Research Institutional Review Board is underway with the preparation of accreditation requirements, research protocols, standard operating procedures, and training of members of the Institutional Review Board. As we go on the completion of the functionality of the different subspecialty centers, we want to venture into opening subspecialty training programs. With this, our young doctors will no longer go to centers in Manila for training. Undeniably, the pathway is challenging and rigorous, but we have set forth our vision and mission. We will leave no stone unturned, face all stumbling block head on, making the best of any bad situation to our advantage. Because at R1MC, we don't predict the future, we create it.